Hello, I'm Dr. Manning. We're going to be doing a podcast today for Mississippi Vein. That's my flagship business. We have Mississippi Vein, Mississippi Medical Aesthetics, the men's clinic. But today we're going to be talking about some venous stuff. We treat spider veins, we treat varicose veins, and we treat venous ulcerations, which are really the most severe form of lower extremity venous disease. That's what we're going to talk about today. Venous ulcers are non-healing sores that occur really right above your ankles in what they is termed the gator area of your leg. And they are a result of really severe venous disease that you typically inherit, from a parent, maybe a grandparent. And when the venous pressures in your leg get high enough, you get enough pressure pushing back against your capillary beds that you can actually break your skin down. And that's called a venous ulcer, and they're painful, they weep, they're just very difficult to live with, and most importantly, they can be fixed. I've had Mississippi Vein now for going on 20 years, and I don't know that I've ever seen a venous ulcer that we couldn't fix at Mississippi Vein. And here's how we do it. So you have your leg like this, foot down here. Typically, your venous ulcer is in this area right above your ankle. And it's actually the result of a malfunction in a vein deeper in your leg that's feeding the ulcer, and another vein that comes off of your deep venous system to the ulcer. So the way we fix it is we slip a laser fiber that's long and skinny. It's looks kind of like a piece of fishing wire. It's a little thicker than that, but a little stiffer than that. And we use ultrasound guidance, and we put the fiber up inside the vein, and then it's hooked to a laser system that has a pullback device on it. And as the laser is firing, it is pulling the laser back out of your leg. So you can kind of conceptualize welding. We're thinking about welding that sick vein together. And so we actually ablate it, take it out of circulation. And then we get in this perforating vein and we ablate it as well. And when you do that, now the venous pressure is normalized. Your capillary beds, which actually feed your skin, start working again, and the ulcer begins to heal. And then another thing that we do, we draw blood from our patients and we make something called platelet-rich plasma, which is filled with growth factors. And we actually inject that into the venous ulcer to speed the healing of the ulcer. Now, all of our patients at Mississippi Vein are sedated. We're very big on the patient experience. We don't want to be hurting anybody. Both myself and my partner, Dr. Cliff Adams, we're both anesthesiologists back in the old days. We've been doing vein work, for the last almost 20 years now. But I like my patients knowing that because, number one, you're safe when you come to Mississippi Vein with respect to sedation. And number two, we're not afraid to sedate you. So, you're going to forget what I say, you're going to forget what I do, but you're not going to forget how I make you feel. And so I want to be friends with my patients on the other side of the procedure. So I don't want to be hurting anybody. So all this is done with you comfortably sedated. You won't remember anything that we do. And venous ulcers, after you do the kind of treatment that we do for them, they typically heal completely within 6 to 8 weeks. We keep patients in compression hose until the ulcer is fully healed. We typically see ulcer patients back every couple of weeks until that ulcer is totally healed, so we can just keep track of everything and make sure that it's healing on the timeline that we want. But one of the hallmarks of venous ulcers is you'll see people that discolor their skin, and that what's happening there, and most of us have seen people with brown on their lower legs before. That is actually iron deposition in your skin. It's coming from the high venous pressures that are actually pushing red blood cells out into your skin. They die and they leave their iron behind. So basically it's rust. The fancy name is hemosiderin staining, but once you get enough of that in your skin, that helps form the ulcer as well. So if you have it, or if you know a family member or a friend or somebody that has discoloration on their lower legs, it's very, very important to get them in for treatment as quick as you can, because we can fix venous ulcers after they form, but it's a lot better to head it off before they do form. So what you're looking for is that discoloration on the lower legs. That is predisposing those patients to venous ulcers down the road. So definitely get into Mississippi Vein as quick as you can if you have that on your lower legs.